See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist Shauna Butler.
The pandemic broke down barriers that had been in place for the nursing profession for decades in ways no one could have predicted. Things were happening in record time.
We stepped up to provide COVID-19 testing services, as well as more recently the COVID-19 vaccinations.
Trans Health incessantly has been trying to work to expand telehealth in general and to really increase access to care.
We do clinic pop-ups that we learned in the pandemic, and we always bring a recruitment person.
Nurses were taking on new roles and leading in ways that hadn't been seen before. And maybe nurses had been doing it before, but it hadn't been seen. The pandemic brought down these long-standing barriers and really allowed nurses to step in and step up and do the things that we know that they're educated and ready to do. If we could say there was an upside of the pandemic, that was the upside.
Welcome to See You Now. I'm Shauna Butler. The pandemic having an upside? Surprisingly and interestingly, yes, it has. While the pandemic has been an instigator of calamity, complexity, and uncertainty, it's also been an unmatched driver of warp speed healthcare transformation, one that, in crucial and impressive ways, saw nurses fuel and lead this transformation sprint. And it is critical that these visible, consequential gains of nurse-led innovation not be lost, and that the data, the experience, and collective learnings be recorded, analyzed, and urgently brought to life in the form of well-researched and authoritatively written reports. And so, in this second episode of our Reporting Power series, we're centering on how one such report can be brought to life. Published as a collaboration between Johnson & Johnson, the American Nurses Association, and the American Organization for Nursing Leadership, the Accelerating Nursing Transforming Healthcare Report is a significant and timely body of research offering a compelling narrative about the swift and massive changes ignited by the COVID-19 pandemic. In the first episode of our Reporting Power series, we discovered the special character and ambitious nature of the Accelerating Nursing Transforming Healthcare Report and the role other authoritative reports play in generating ideas, inspiring change, influencing legislation, driving innovation, and promoting health equity. For a better understanding of precisely how nurses are weaving the needed changes and innovations into their organizations, care delivery, and workforce, in this episode, we go behind the scenes on a listening adventure. And we hear from three changemakers about how the pandemic changed access to care, changed care needs, and impacted the well-being of the healthcare workforce. Through their voices and thought-provoking stories, experiences, and the fine and gritty details, we gain a better understanding of just how nurses are accelerating nursing and transforming healthcare. But first, let's listen back to Linda Benton, who leads Johnson & Johnson's 125-year commitment to supporting the nursing profession, to hear her explain the motivations and the methods and the intentions of the report, whose title captures the urgency and gravity of the moment.
Nurses were front and center, doing the work that they were doing, saving patient lives every day, but it was also very clearly apparent that this pandemic was taking an incredible toll on the nursing profession as a whole. So I've said, if we're really out here supporting nurses, we have to take the time to understand and learn from this pandemic and how it impacted the nursing profession as a way to really understand where the nursing profession needs to go as healthcare continues to evolve. The Accelerating Nursing Transforming Healthcare report was a very clear point in time where we were doing extensive quantitative research with 4,000 stakeholders and then taking the learnings from that quantitative research in August of 2020, and then hosting our qualitative interviews with 33 nurse leaders or nurse advocates from there on in. We didn't know what was going to come out of that, but we needed to give it some structure. That's how we arrived at 3 different topics of care delivery, organizational structure, and workforce of the future. They're all interconnected, but that was the best way that we could figure out how to really bring the papers to life. It should be ideas that people can tap into and say, hey, this applies to what I'm doing in my part of the healthcare system. How do I give this a go and give it a test and learn?
I think that a lot of those reports are finally putting nursing in the place to say, let them drive, let them innovate, give them an environment. They can do what needs to be done to take healthcare in a new direction. And they can do it with love and empathy and joy and hope, as well as having the technical and scientific expertise. Because that's the beauty of nursing. It's a heart job, but it's a science job. I'm Julie Kennedy Ehlert. I'm the Chief Experience Officer at Vidant Medical Center, which is our academic medical center, our flagship hospital for the Vidant system. It's a almost 1,000-bed academic medical center in a town of 90,000 in Eastern North Carolina. I am strategically responsible for the patient experience, team engagement and well-being, equity and inclusion, which I work on with our Chief Diversity, Inclusion, and Talent Officer, workplace well-being, and safety. And that's my kind of strategic bundle. So I do the goal setting and the strategy around that. And then I have operational responsibilities for EVS, environmental services, food services, language access services, hospitality services. And then I oversee all of marketing and communication, including digital, for the entire health system. Now, I do have an analytics arm because I'm a data geek. I love looking at data in a holistic way. So I have an analytics arm that looks at patient experience, team engagement, well-being, all those things. And then I have a design arm, which helps design all the beautiful things that we do that influence patient experience, team engagement, and well-being. Eastern North Carolina is a big personality. There's a lot of diversity, and there's a lot of unique community vibes. Our communities are our team members, are our patients. We have all the normal healthcare challenges, but rural America is often forgotten and has its own compounded challenges. Some of the unique challenges have to do with the rural nature and those small communities. People can't get places. People don't have access to things that they need or want. Anywhere where there is rural environments, those kind of forgotten places, anywhere in the world, these challenges would be the same. And there are certain things that we do really well in medicine now, but they're time necessary. A cardiac arrest, a stroke, having a baby. When you're in an urban environment, you're 10 minutes from a resource. Here, you could be an hour and a half from a resource. And that brings with it a lot of really interesting possible solutions. So very different than some organizations who have a lot of small hospitals that feed the big hospital. We push a lot of our care and resources and health needs deep into the region, because otherwise our patients wouldn't have access to them, and we would not be honoring our commitment to serve them and love them and care for them. We believe that culture is defined by how our relationships are structured with each other, how we treat each other, how we treat patients, how we treat our community. And that definition is very actionable. That means that everyone can participate in allowing a new culture to emerge. That means that relationships have to become very, very important, even at the strategic level. There's a whole bunch of research around what happens in hierarchical, fear-based cultures. You can't innovate, you don't have good quality, you don't have great patient experience, team members are stressed. And so you have to go where those structures are and dismantle them strategically through how you set goals, how you do your work, how you do leadership development, how you do HR processes, what your policies look like. And so you really have to start that dismantling so that new culture can emerge. And to be honest with you, this is where healthcare organizations sometimes fail, especially when it comes to the patient experience. Patient experience is a lagging indicator. You will never have great, authentic patient relationships and positive experiences unless you have team members who feel cared for and valued and are engaged. So most of the work I did in the first 2 or 3 years that I was here was focused on team members, love, empathy, and bringing those elements into the relationships so that that new loving culture could emerge. Innovation happens in desperation, and that was us. Vidant was trying to grow and be a system. We were struggling. So how was all that stoic power over stuff working for people? And people were like, it's not working for us. I said, well, how about love and empathy? Because love works all the time. I designed for the first 2 years with an intention of love. If it didn't feel loving, I just would not do it. And that was fascinating to the team. And also, when I told the board that we were going to be doing some empathy salons, some gratitude, hearts and minds work to prepare the culture, and it was only going to be done through attraction, they were like, yeah, nobody's going to come. And I said, if I make it beautiful, they will come. And they were full constantly, because healthcare is not transactional. It's a relationship. And it's only effective if it's symbiotic and benefits both parties so both can thrive. But here's the fascinating piece of all of this. It is very clear in the science that one type of culture begets certain things and one type of culture doesn't. So in a power with culture, you get a lot of innovation, you get a lot of empathy, compassion, you usually have good mentorship, you usually have good talent management, you have shared decision making, and great patient experiences, great quality outcomes because people aren't afraid to report near misses. So that culture will deliver results that everyone in healthcare wants. Go deep down into the organization, and if you have too much fear and hierarchy, you probably are not able to achieve the results that you want and the consistency that you want. Preparing the culture for well-being and wellness, and for at least acknowledging and thinking about gratitude and empathy going into the pandemic served us really well. The whole concept of getting the teams together and having them talk about empathy broadened our ability to maintain resilience in the beginning of the pandemic. The things I think about is how we transitioned some of the empathy and love into how we responded to our communities. So here we are, the pandemic is upon us. We need to reach low trust communities in rural areas to tell them about masking, how to keep them safe, educate them about COVID, and then eventually how to get vaccinated. And we did it through our team members. We'd gather our EVS and food service workers and give them a package of masks, hand sanitizer, and say, here, take this home for your family. And now we always do through our team members. They can be very activated, especially when it's about their families and their communities. We just let the community talk to us. People would say, can you make me flyers to put on doors in our communities? And we're like, yes. What do you want them to say? What do you think will compel people to get vaccinated? And so again, we transitioned that listening, design thinking, empathy for the end user, define it, ideate, test it. And we just tried everything we could think of. And even in the midst of sadness, we kept saying, never waste a good crisis. I have so many innovative things I'm doing right now to help our nurses because I can't find any. But when you get to the place where it's not about the metrics right away, it's about the relationships and how you treat people, things change quickly. Putting resources to build out your workforce should be key for everyone right now in healthcare. We have a homegrown program. So if you want to be a nurse, you work in EVS or food service, we make it possible for you to become a nurse. So a lot of the interpreters go back to school and be nurses. And then we have bilingual nurses. They probably wouldn't be able to do that unless we helped them. Is it a costly program? Yes. And we now have lifetime nurses that are deeply loyal to Vidant. We do a variety of things related to recruitment that are very relational. We do clinic pop-ups that we learned in the pandemic. The community says, bring us what we need, and we pop it up, a clinic, whatever they need. And we always bring a recruitment person. So we actually give people jobs, which is what our communities want. So we hire right out of these community events. And then as soon as our entry-level workers get here, we say, what else would you like to be? What else would you dream of doing? Do you want to be a nurse, perhaps? Because I really need about 1 million of those. So how about nursing school? How about nursing assistant school? So we do a lot of really relational recruitment right from our low trust communities. This is the best. So our team members in talent discovered this young girl. She was in the line at the food shelter. She had been in foster care her whole life. She was working at Dunkin' Donuts, but she didn't have enough money to get out of the homeless shelter. Our team said, well, we'll go in, and they got her a job in food service. And this is kind of the empathy part. So she didn't have a car, and she's still at the homeless shelter. So someone from food service picked her up every day and dropped her off. Well, she had a full-time job, so she couldn't stay at the homeless shelter anymore. So everybody rallied and got her an apartment, and people from all over donated things so she didn't have to come home on her first day to an empty apartment. And she just was signed up for nursing assistant certification, which we pay for. And she's going to grow up and be a Vidant nurse. And 100 of those stories adds to the diversity of the workforce, the loyalty of the workforce, and actually the beauty of the relationships, because caring for others and having gratitude for others is part of the cultural fabric that we really want to perpetuate. I want to send my gratitude and love to everyone in healthcare that has worked so hard in this pandemic. Never waste a good crisis, but that doesn't mean that we haven't been sad or worried or afraid. And then I want to give a quote from one of my mentors, Teddy Potter, and she used to say very kindly to me when things were very chaotic, Julie, sometimes things have to disassemble before they reassemble. And that gives me some peace, because healthcare is disassembling, but it's only disassembling so we can reassemble it in a much better, more loving, more caring way. That is exactly where we need to head for healthcare to be what we need it to be for our future.
Throughout our history as a community, trans and gender diverse people have looked to each other for healing, support, and affirmation. Trans Health Northampton honors that by providing comprehensive and professional healthcare, as we have opened our doors to trans and gender diverse individuals and their loved ones. As a trans-led organization, we are uniquely positioned to expand healthcare possibilities for our community. Through research, expert care, and fierce advocacy, we work to secure a healthy, affirming future for all of us. Hi there, my name is Dallas Dukar. My pronouns are she, her, and hers. I am the founding chief executive officer of Trans Health Northampton. At the core of all this, especially in a mission-driven organization, you have to have humor. And I think that's one of the things that I appreciate most about our team is people are just so funny and able to laugh with each other when things might seem absurd or strange or pushing up against something. It's just so important to be able to laugh. Trans Health Northampton is a groundbreaking, independent, and comprehensive trans healthcare center built to empower trans and gender diverse adults, children, and families. I also serve on faculty at Northeastern, University of Virginia, Columbia University, and I'm a researcher, I'm an educator, I'm a nurse, I'm an advocate, I'm an activist, and I really want to revolutionize healthcare and build novel systems to provide holistic, empowering, affirming care. Someone had said they didn't even realize that they had experienced discrimination in the medical field until they went here and they were treated with utmost respect as a non-binary individual. And to me, that just hits home on so many levels. A recent report from the Center for American Progress said that nearly half of trans respondents and 68% of trans people of color reported discrimination. That's most trans individuals experiencing discrimination in a primary care setting or in any other clinical setting. But when you experience discrimination in a primary care setting, you're much less likely to then go back there or show up for urgent care. You might wait till you're in emergency care. And that initial discrimination has had a compounding effect where someone's morbidity and possibly the chance of mortality has increased, the healthcare costs have increased. And this isn't just preventing some exacerbation in a health condition, but it's really just affirming people. You don't have to be seen as different. You don't have to explain yourself. You can come in, just be able to breathe easy and be able to see yourself reflected in your providers, in the nurses. It's not just about the clinical care. It's really about feeling like you can be a part of building a home. When we talk about discrimination, there are countless examples of discrimination. It starts in terms of not being able to be seen first and foremost, and that means just not having the right name or pronouns used. When people don't acknowledge pronouns or don't acknowledge someone's name just to start with and are not acknowledging someone's identity, it can mean that people are outed right there and then, and that they don't feel safe being able to come back into that space. Or there's cases where people have lost their insurance because they're trans and then been unable to access hormones and had to live on the street. They end up in fear of actually letting others know that they are trans. And so then they may not report it. And when they don't report that they're trans, especially to clinics that should be collecting this data, which is called SOGI data, or sexual orientation, gender identity, and intersex status, when it's not collected, then we don't have a number, an actual estimate of how many trans and gender diverse folks or those with intersex traits actually exist in the country. And if you don't count people, then they don't count. And many non-binary individuals experience high rates of discrimination in medical care settings and clinical care settings. And then when you overlap that with also racial or ethnic discrimination or discrimination against disabled individuals, you come up with a system that really only cares for individuals that fit a specific mold. I truly believe that systems that are built to advance gender-affirming care are so important and need to be inclusive by design. We need healthcare to be that space of liberation, not discrimination. And so along with receiving care here, along with receiving mental health care here, whether that's psychiatry or therapy, we have community services too. And we're getting ready to offer makeup classes and hair classes, weightlifting classes, tax preparation classes, whatever folks need. Along with that clinical stuff, it's about creating a space that feels like a space that you can call home. We really have the power as nurses to be able to change healthcare. This starts by not only living our own values, but also holding nursing as a profession to its values. So when we think about health equity, we think about how do we remove barriers. When we think back at what it takes for trans people to just be able to get access, there's so many barriers. And when we think about access to care, who's closer to the patient than the nurse? Professionally, my role as the CEO of Trans Health Northampton and founding a groundbreaking, independent, comprehensive trans healthcare center, I see myself as a leader in this space, ensuring that those values of justice, of equity, of human dignity are able to be manifest in policy. I see this as an opportunity to push the bounds of what healthcare can be. This is gender-affirming healthcare, a profound expression of patient-centered care, and it offers a model for all of healthcare, one that's been shaped really by an active, informed, and vocal patient population that has unfortunately had to learn out of necessity to demand rights, be seen, and to be cared for. In terms of innovation, we have been the first practice to really push this model of nurse practitioner autonomy, especially right after the Full Practice Act was passed in Massachusetts. And so our internal momentum to ensure that people are able to be independent and practice independently then has outward ripples. But also, many of us are coming from spaces where we've experienced our own form of what I would call medical trauma. And we've really had to take time to ensure that we don't re-traumatize each other, because we're so used to being in those environments sometimes, thinking that we're actually fighting against someone within, versus instead remembering we're all on the same team. And so we really try to take time and remind ourselves to do that. We also have a budget that is completely transparent, that we 4 times a year and anytime anyone requests, walk any staff member through our budget, why we made certain decisions, and really thinking about the implications of justice here and how we actually are able to make sure that we are held accountable in spending the resources that we have. One thing that we've been doing at Trans Health incessantly has been trying to work to expand telehealth in general and to really be able to increase access to care. So, for Trans Health Northampton, there's an estimated 20,000 trans and gender diverse folks in our catchment area, in a rural catchment area. And this is in New England, so the states are relatively close to each other, and the divided nature of healthcare based on accessibility makes it really difficult to see patients who are in need of it in the most rural setting. But at the end of the day, interstate licensure issues create a barrier for patients. And what happened in the past couple years during the COVID pandemic was we saw so many states expand telehealth temporarily and then restrict it. We've never seen a more unilateral restrictive action, at least in Massachusetts, to restrict access to care for folks in other states. And this drastically has reduced the availability of care for our most marginalized, specifically trans patients of color in rural settings. To me, providing equitable care means really providing individualized care, knowing that there's not a one-size-fits-all model. We need to also be providing equitable care that ensures access to care. Affirming care is being able to care for those complex, disparate, different parts of one's life. In short, it's what nurses do best, working to create a healthcare system that is responsive to one's identity versus having people try to respond and fit themselves into a healthcare system. But also, when our patients get to be honest, when our patients get to be curious about who they are, this also creates space for healthcare clinicians and staff to be themselves and inevitably reduce burnout. This is the healthcare we all strive for. This is one of authenticity. But I think what's perhaps most important in my mind in terms of achieving health equity is hiring staff that are representative of the most vulnerable communities that you serve. And if you can't find those staff, if you're having trouble hiring them, expand the hiring process, invest more money in it. If that doesn't get you anything, then create scholarships, create systems within your own space to be able to lift people up, because it's when you have spaces that are really staffed by some of the most vulnerable folks that you're able to really address those very individualized needs that don't need to be surveyed over and over again. They need help.
Two decades ago was really around what is the healthcare consumer asking for in their healthcare experience at that time. And it was really around convenience, access, affordability, quality, but also caring, empathy, education, transparent pricing, being open on weekends and evenings and most holidays to be there for our patients when they need us most. All of those things became part of the foundation of retail healthcare and part of the MinuteClinic model. Hi, I'm Angela Patterson, and I'm the Chief Nurse Practitioner Officer for MinuteClinic. I lead our organization's more than 3,000 nurse practitioners and PAs and more than 1,500 nurses who staff our more than 1,100 clinics across 35 states and Washington, D.C., and patients can also access a MinuteClinic care visit through our eClinic virtual care platform, which spans across 49 states. Not only does our logo include a heart, but it embodies a concept that is part of our company purpose, which is bringing our heart to every moment of your health. And when I think about the MinuteClinic nurses and what they do every day, they have the patient in their lens. It is about caring for our patients, certainly with quality, but also with empathy and compassion. And I see this being lived out every day in our practice. And it is really so inspiring. We're truly a team connected to one another. And some of the things that make me so excited to be part of this work is that tremendous appreciation that patients have for the ability to access care at their convenience when they need it. Sunday mornings, when your child wakes up and has a fever and an earache and you can't access the pediatrician, and having an alternative other than the emergency room to receive quality care is so important. Or whether our providers are working with the patient living with diabetes and helping them to monitor and manage their disease in support of the work of the broader primary care-based health system. Overall, we see our role as delivering complementary primary care, that we work to fill gaps in care for patients who've fallen out of care. Perhaps they've moved or their primary care provider has retired. And on average, 40%, and in some regions, 50% of patients who present to MinuteClinic report to us that they do not have a primary care provider. Working to help connect them back into the primary care-based health system is another way that we deliver the kind of care and the needed advocacy and support It has been so wonderful to be part of bringing this to our healthcare delivery system nationwide. Ideally, it's a better experience that leads to more engagement, more of a sense of caring, and ultimately improves their health and well-being. About 18 months ago, we quickly learned that the needs of our patients were changing as a result of the pandemic. And as a healthcare practice, we focused on a couple of things. One was to quickly ensure the safety and well-being of our clinical team on the front lines. And then secondly, being there for our patients, responding to their changing needs. When other care access points were not open or open only to the critically ill, we work and help people with not only their acute medical needs or manage ongoing chronic conditions, but we also understood that people weren't comfortable with leaving their homes but still needed care. So we stood up a rapid response with our e-clinic service to enable patients to connect virtually with a MinuteClinic provider during the 9 to 5 workday or 24/7 with our video service. The other thing that we did was quickly pivot our people, our resources. We stepped up to provide COVID-19 testing services very early on in the pandemic, and we continue to provide that service to this day, as well as more recently the COVID-19 vaccinations. Throughout this time, our providers were sources of information and comfort for many patients. Folks really came together, prioritized the work, committed to working together, securing resources, mobilizing teams quickly, and then continually learning, and just an iterative process. But I think it starts with the commitment to be there, be a partner in health, not only internally, but with local authorities and others to bring to bear resources and the people power to address the health need at the time. Sometimes we learn as we go. Many times decisions need to be made swiftly, and there's less data and less history that would give you best practices in certain situations. The learning as you go, the continuous and dynamic feedback, conversations, and process improvement, being agile, having your A plan, but then also having your B, C, and sometimes your D plan if things go sideways is an important part of it as well. Programs and delivery systems and initiatives, it all matters. And having those things help you to do amazing and remarkable things. Like one of the things we did at MinuteClinic during the pandemic earlier this year was launch our mental health services pilot. So in select locations, we're now including staffing with licensed social workers to provide on-site mental health services. And we're continuing to build out that pilot and learn from it. That's just an example of responding to the healthcare need at hand. And it was about being agile, being innovative, willing to be bold, take some risks and learn as we go, and also continuing to build upon our purpose to meet the healthcare needs of our communities. One thing I know, just being a nurse for more than 35 years, is that nurses are the keepers of our patients' stories, and their voice is an important part of leadership decision-making. They understand and experience the patient experience and can really speak to it. Nurses are tremendous problem solvers. I think nurses also bring an incredible level of, and a unique level of compassion and empathy as leaders. So really, when you think about being part of the decision-making table, those qualities and traits are very productive and important parts of how the strategic work is done. Building a pipeline of nursing leaders within our practice is an important piece of the work that I lead and an area that I prioritize greatly. We support them in developing talents and skills to be able to step into their roles through things like an emerging leaders program, learning experiences, stretch experiences, mentorship programs, opportunities for our providers and nurses to develop skills, have learning experiences, I love supporting nurses to ready themselves to lead healthcare. And every day I wake up and I always have to remember that my job is to care for those nurses, those providers, as they care for our patients. And the way that I care for them, think about them, work to put things in place to support them, will always be reflected in the care that they deliver to patients. It's structural, it's organizational. There's so many different ways and so many evidence-based ways to put nurse well-being into action, into an organization. As leaders, it is imperative that we focus on how to support the needs of our nursing teams, not just their clinical and operational needs, but helping them to stay resilient, ensuring they take time for themselves and prioritize restoration. Looking at benefits, including things like childcare and caregiver benefits, programs that prioritize physical health, emotional health, purpose, social connectedness, recognition programs, as well as support for recognizing our nurses who are volunteer, prioritizing behavioral health. The other piece is to work within the organization to ensure that we're establishing and advancing a culture of psychological safety and ethical practice through preventing workplace harassment and incivility, ensuring that we're creating diversity and inclusion programs. I know at MinuteClinic, we recently launched an enterprise-wide strategic diversity management team. And we also need to make sure that we're evaluating the health of our workforce, including retention and turnover and engagement. We're hearing from our nurses. We're receiving their feedback. What are their recommendations and suggestions for improving their experience as colleagues within our organization? What more can we do? And it's important that as leaders, we hold our nursing leaders accountable to our nurse well-being and ensure that that's part of our strategic work, our performance appraisal, and really embed it as an important organizational strategy and priority. To me, it's really important, not only because it drives the health of the workforce, it builds trust on the part of the nurses. It's trust in the organization that we have your back. I would say probably one of the biggest surprises for me when I first joined MinuteClinic almost 15 years ago, and we just had a handful of clinics and a handful of states, was how willing nurses were to embrace a novel, disruptive site, and really just understood that there's so much about care that's about the provider, the nurse, and the patient. And that the closer you get to delivering that in the community, the more meaningful it is for the patient and the more impact you can have.
Advanced practice nurse Angela Patterson is Vice President at CVS Health and Chief Nurse Practitioner Officer of CVS MinuteClinic. Before Angela, we heard from nurse and activist Dallas Ducar, CEO of Trans Health Northampton. And we started off our listening adventure with nurse and relationship builder Julie Kennedy Aylard, Vidant Health's Chief Experience Officer. A truly heartfelt thanks to our episode storytellers for sharing with us their experience, wisdom, bold ideas, and caring hearts as part of our Reporting Power series inspired by the Accelerating Nursing Transforming Healthcare report led by nurse champion and advocate Linda Benton from Johnson & Johnson. Each of them believers in the power and readiness of nurses to be drivers and partners in healthcare transformation. Through their stories and data, Julie, Dallas, and Angela convincingly convey, without organizations and their structures centered on and committed to the well-being of their talent and workforce, high-quality care, compassionately and consistently delivered, will not happen. A workforce that is valued, seen, prepared, supported, trusted, developed, and yes, loved and loved on is where the magic and innovation happens. And it takes an intentional and an immediate investment. As Julie calls out, putting resources to build out our workforce should be the key for everyone right now in healthcare. She reminds us, it's a relationship, and it's only effective if it's symbiotic and benefits both parties so both can thrive. And as Dallas reveals, an important benefit to creating a diverse representative workforce one where each team member feels their whole authentic selves are seen and appreciated, inevitably reduces burnout and brings joy to work. As we deepen our understanding and commitment to health equity, these stories reveal how innovating with an intention of equity, that when we think about how we organize our work, our teams, and our systems, when we consider how, when, and where to deliver care, when we build, advance, and support our colleagues and our workforce, absolutely we can address the inequities in our healthcare experiences and systems and deliver care that is representative, affirming, and greets people where they are with a hug and a warm smile. Coming up in the next 3 episodes, we'll hear extended conversations with each of our storytellers, conversations that will give us a more in-depth look at who they are, at the work they're leading, and the impact it's having. And in case you missed it, be sure to listen and share the first episode in our Reporting Power series, Rehearsing the Future. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.